Hello, everyone. Mike Good here. I'm your host. I'd like to welcome you to the Together in This show, where we have conversations to empower people who are fighting back against dementia. And when you're caring for someone with Alzheimer's or another dementia, getting your ducks in a row has many benefits, but it's not always easy to accomplish when you're constantly on duty, huh? So knowing what tools to use and how to use them sure can make things a lot easier, though. So just a few administrative things here. We are broadcasting live into your homes, which is pretty high tech. So if you have any issues with the video or audio, start by refreshing your browser. Now, streaming video is a resource hog. So if you're running many applications and your family's all using the internet, it's possibly going to be fuzzy. But try closing down some applications. Try to just have your video up. And the bigger your video is, the grainier it's going to be. So just keep that in mind. And if all else fails, up in the right-hand corner there where we chat, you'll see the sticky note that shows a link to a YouTube where you can actually go in and watch the video there. So if you have any trouble, just let me know. And if you lose me, which happens, I'll get back on. That takes a couple of minutes, but please be patient and we'll get started there. So with that, I'm going to go ahead and start sharing my screen about patient care plans. I call this a vital tool for caregiving. So if anybody is on the chat, please go ahead and use the chat. Let me know you're there. I'd like to hear who's online. It's always nice to know. So first of all, let's talk about who I am, or maybe better, who I am not. I'm not a medical, legal, or financial professional, and the information provided in this presentation is done so as an information resource and is not to be solely relied on for any diagnostic or treatment purposes. At all times, please contact the appropriate professional if you're in need of any professional advice. Why am I doing this? Here's a quote from a professional in-home care provider that sent me this, and he says, "When going into a home for the first time, I generally see little in the way of care planning. Most just wing it until there's a need for professional assistance. This would help greatly if they did create some type of care plan among themselves." Now, the reason he's saying this is twofold. First, from a personal standpoint, he knows that caring for someone with Alzheimer's in a chaos mode is not healthy for either the caregiver or the care recipient, and that getting your ducks in a row can definitely help improve the care you provide. From a professional standpoint, he knows that eventually people need to bring in professional services, so making that transition as smooth as possible is important for keeping everybody healthy and happy. So I found this picture on the internet yesterday by chance, and I thought it was very appropriate. And what you see you've probably seen this before, but what you see on the left-hand side there is what we plan, what our vision is. And then, especially with Alzheimer's or dementia, on the right there is what really happens. We're spun in circles and we're just going crazy. And my goal is that with helping you with some planning and organization, that while we're never going to get that smooth trajectory, maybe we can iron out some of those wrinkles and make it a little bit smoother for you. So why have a care plan? A care plan helps to ensure that the mental and physical well-being of the care recipient is maximized at all times. And it combines the goal of the care recipient, their family, and other care partners. It also importantly helps reduce caregiver stress, and it helps you protect your own health, because now you have a tool for providing direction to others and improving your communication with others when your loved one is in their care. And it's all about the family living well with Alzheimer's. There's not just one person that gets the diagnosis, it's the entire family that gets a diagnosis of Alzheimer's. Your role as a caregiver is the project manager. Now, of course, you have a lot of hats as a caregiver, but in this instance, you're the project manager. You're responsible for the development and the implementation of the care plan. And now this is going to be a lot of work, but you can do a little at a time, and a little each day, 5 minutes a day, 10 minutes a day, 3 days a week, whatever you can do, you do a little at a time, because again, it is a lot of work. And in your role as caregiver, you bring all the stakeholders together. The stakeholders, I mean anybody that's helping with your loved one's care, from the dentist to the hairdresser to the pharmacist to the neurologist to family, friends. And we incorporate their skills, goals, and responsibilities into this plan. And that helps. And during this time, we want to always keep the care recipient involved in the process. Even though at some point they may not have the ability to communicate clearly with you, they can still hear you, and they still need to be part of the process. So definitely always keep them involved. Now, a care plan has 3 components that I'm going to talk about today. You have the medical summary, the medical action plan, and the patient daily care plan. Each of these components is developed individually and comes together in one document. And just a quick reminder, please don't hesitate to use the chat and ask questions as we go along. I'll pause throughout and make sure we have opportunities there. These 3 components must be reviewed and updated periodically, because as you know, the disease progresses and the abilities change and needs change. So if the plan isn't updated regularly, it will just become stale and it won't be useful. And these update intervals vary depending on the patient and where they're at in the disease. But you really want to define a schedule, whether that's once a month, every other month, once a week, whatever. Have a pizza party around it. Do something to make it a little less mundane, but try to put something in stone. And now, while you probably feel like Wonder Woman, wish you were Wonder Woman, you still need nudges too. So, if at all possible, assign someone other than yourself with that responsibility of ensuring that the review cycle is complete, because you're going to get pulled into this disease and you need someone helping you. So I realize that isn't always possible, but we're going to try to make it possible. Okay, so a medical summary, the first piece of it. This is a collection of patient information. It enables all the care providers, again, doctors, family, friends, to make informed medical decisions on a daily basis or in the event of an emergency. And just forgot to mention that everything I'm covering here today can be found on the Together in This website, and I will provide a link at the end of this workshop so that you can go there and find all the resources, all the forms, and all the text, if you will. The medical summary also, it includes things like medications, any health issues, their prior medical history, and contact information so that all the care partners can communicate and work together. So the first form, now there's different versions of all these forms, and I went out and tried to find the best ones for you, and when there weren't forms, I created some. So in this instance though, the medicine form, it's made by the FDA, and as you can see, hopefully, that it just walks you through different things to document. It talks about what the drug is, what it looks like, how much to use, who prescribed it, who to contact. Now, I highly recommend that you put everything your loved one is using on here, from prescriptions to over-the-counter, herbal supplements, vitamins, anything like that should be on this form. And you can probably understand the importance of keeping this updated regularly because medications change. Another form is one I found. It's very extensive, and this is just an excerpt from it. It's for the medical history. This is an excellent form provided by Next Step in Care, I think. We'll look at that in a minute. But on this form, for instance, you would document things like any allergies they have, what their reaction is, the last occurrence, how to treat it. You might document whether they have arthritis, asthma, kidney disease, and again, we'll take a look at this form in more depth because it has a lot to offer. So the next piece of this is the medical action plan. And this is information on how to provide treatment to the care recipient if their health should decline for any reason. This ensures that when you leave your loved one in the care of someone else, you need to be able to have peace of mind that they are going to do what you want them to do, because nobody provides care the way you do. But you have to empower them. So this helps ensure that when symptoms strike, there's a plan of action that that person caring for your loved one can follow. This medical action plan includes everything from minor changes that can be cared for in the home to emergency situations that may require immediate action. It also contains, like most of the forms, the basic patient information, emergency contacts, and any special health issues along with the associated signs, symptoms, and actions. Now, this is a form I could not find anywhere on the internet that was tailored towards older adults and specifically for people with dementia. So this is a form that I created using the best of what I could find out there. So the first piece of this form is the patient information, obviously name, date of birth, phone number, allergies, any other health issues. And these forms can be tailored to meet your needs. The second piece of it is the emergency contacts, a primary and secondary contact, along with a redundant phone system there where their alternate phone, documenting who their doctor is, what their phone number is, the address, the closest hospital, and its address. Really, we're trying to empower anybody that's caring for your loved one to have quick access to the contacts that they need to provide care for your loved one. And the third piece of it, this is where we actually document the health issue. Now, I've got 3 columns here, but not all health issues need to have all 3 columns completed. So you got mild, where you can care for it in the home. You've got moderate, where you would want to contact a doctor. And then you've got severe, where it's like call 911 now. And for mild, where you can care for it in the home, at the bottom, you can list your self-care steps. So the simplest example of this would be a fever. Obviously, if the fever is only up a little bit, you're going to try to care for that in the home and try to get past it. But if it's reached a certain level, you want to contact the doctor. And then obviously at a certain level, you need 911 emergency room help. Any medical issue, health issue can be put into this form with your steps, how you want care provided. Now, again, not all issues will have symptoms in all 3 columns, and sometimes self-care is never appropriate. For instance, someone falls and breaks an arm, you're not going to want someone to splint that at home, right? You're going to want them to go to the emergency room. Also, it's highly recommended that you have your loved one's doctor review this document, because it is such a critical piece. And this final plan, it needs to be posted in an obvious location where it can easily be seen, such as the refrigerator. and every person in that care circle must be aware of its location and familiar with the included information. Now, before we go on to the next piece, I'm going to break out of here because the next piece is pretty complicated. And I'm going to come back on screen. So I see I got, Gail, thank you, Susan, Marshall, Leslie, thank you all for joining us. I'm familiar with you guys, with some of you, some people I'm not. I appreciate everybody attending. And I think what I want to do is I kind of want to touch on, I want to show another one of the forms a little more in depth since we've got time. Yeah, this personal health record, this is a really good form to help people get their information put on paper, because we have a lot of this information in our heads, but we really just need to get it down on paper to help communicate. And it's amazing once we put things on paper what we think about and how it jogs our mind to find solutions and move forward. But in this particular form, you go through, obviously there's a lot of information. You can put their blood types, their occupation, you can put their insurance providers, you can list all their advanced directive information, living will information, power of attorney information. Again, you don't want to let this overwhelm you because there's a lot of information, but it's a really good checklist to go through and make sure you've got things covered. And it's provided by Next Step in Care. And again, there's a link on the website to get to this. And Marshall is asking if there is a couple, is it suggested that both should have this information documented in case an issue arises with either one? I think that's absolutely a positive yes. I think at any time we're completing this information for a loved one, it's a great opportunity to also do it for ourselves. And especially if your loved one's still in the earlier stages and can participate, there's a good engagement that can happen there and a bonding that can happen. And, as your loved one progresses, obviously that'll become less and less. But they also know where a lot of the documents are and can help you find that information. So really every family should maintain a binder of this information and make it easier to find when something happens. Absolutely. But most people, a lot of people aren't that organized, and if they're getting pulled into the chaos of caregiving, that sounds so overwhelming. But if you just do a little each day and start filling it out, eventually you're going to have those binders created. And I have seen caregivers walk in with their big 3-ring binders, and I think that's great. All right, well, let's go on to the next piece of this. Okay, so while the first two pieces were more for organizing and getting our ducks in a row, this piece actually requires a lot of planning, organization, and collaboration. But it's important because this is how we ensure that the daily needs of our loved one are being met. And again, the goal is to bring other people in to help with care so that we can get caregiver rest and me time. So now the daily care plan actually has 3 components: a caregiver self-evaluation. So that caregiver self-evaluation, it's important because you, the caregiver, you're at the center of your loved one's care. And you really need to understand, and hopefully with unbiased look, understand where you're at in the situation and what level of care you can provide. Then we want to evaluate the care recipient. We need to understand their needs and abilities. And then the third piece is actually putting together a daily plan where we identify and fill gaps in the care plan. And we're going to walk through each of these now. So for the caregiver, you want to first evaluate your schedule. Now, if you're an adult child caring for your parent that lives somewhere else, you've got probably a career, a family, you've got your own social life, you've got t-ball with the kids. So you want to lay out, if nothing more, grab a wall calendar and start laying out your schedule and putting down things that are important to you. Put down holidays, put down any kind of vacations you take, and make sure we capture all that. Because what we want to do is we want to find ways to supplement your support with other resources, such as family, friends, or paid services. And we have to remember that we have to establish and maintain me time, whether that's going to church, volunteering, friends, or walks. We've got to try to include that and find ways to preserve it. Next, this is a little bit more difficult. We need to try to perform an unbiased evaluation of your own abilities. Now, this is both physical and emotional. So, for instance, if you no longer drive or you have a hurt back, we need to take that into account. I was just reading on a Facebook group today, a poor lady has got a lower back issue and she's trying to lift her husband out of a chair and she's in pain. So we need to, I know this planning can't always have someone there on the spot for everybody, but we need to try to plan for those type of situations. And then the emotional. This is a little bit tougher too, because it gets personal here. Some people are patient and some people are easily agitated. So obviously, if you're easily agitated, you may need a little more break from people, from your loved one, and maybe that's more important to get paid services, for instance, in that situation. So if you can, when you take this look in the mirror, if you will, if you've got someone close to you that you can trust and you can just be open with, try to have them help you. I know that's difficult, however, because of our egos. You need to also evaluate your own legal and financial situation. Because caregiving is expensive, if you're an adult child caring for a loved one, you need to make sure you understand whether you can leave work and afford it, whether you want to protect your assets as well. Now, if you're the spouse and you have shared finances, you need to understand where you're there, because all this helps us make informed decisions. And next, we need to evaluate the care recipient. Now, you've probably got all this in your mind already. We just need to get it put on paper. But we need to understand their medical and personal requirements to ensure that their health and safety and their well-being is properly maintained. This includes things like their medical records, their current abilities and limitations, and then their personal needs, the things that make them happy. If watching Oprah is what's made them happy for the last 20 years, or Wheel of Fortune, now I don't condone putting people in front of the TV set, but if that's what puts a smile on their face and it's a genuine happiness, then we need to take those things into account. And we also need to evaluate their state of affairs, their legal, financial, their insurance. We need to know, do they have power of attorneys? Do they have deeds? Do they have insurance? What are their assets and liabilities? We need to understand what we're up against and if there's ways that we can pay for assistance. And especially if the person's in the earlier stage of the disease, they can definitely help with that. And the sooner you locate all this information, the better, because it is a ton of work. Yeah, it's hard, Susan. I know people get pulled in and, Susan's saying, I wish I'd done all this. And, I'm hoping just that, through these workshops, we reach people and influence them such that they see the importance and the value and make change. So we want to also evaluate their resources. And what do I mean by this? I mean, we want to list out people that we can trust to help. Family, friends, clergy, anybody in their life, in our lives, that will genuinely help. And I know some people are just in a bad situation and they're the only one, but we need to try to find others. There are volunteers and in those ways that maybe get help. So, and then we want to evaluate their level of commitment and then plan that conservatively. Because people genuinely have a good heart and they will overcommit. You know, for instance, if you've got an 18-year-old nephew and he's committing to help out on the weekends, you got to understand that he's still young and vibrant and needs to be able to break free with his friends and stuff. So, you know, we just got to keep things realistic. And then also we want to look at local services. What's in our community that can help? I mentioned volunteering. There's organizations that can, you know, unpaid and paid, that can possibly help us out in the daily care of our loved one. And the sooner you start looking and investigating and talking with other caregivers, the better, sooner you can vet those out and feel confident and comfortable in having them help. And again, the article on Get Togetherness has links to websites that'll help you find those local services. Next, this is where we actually identify and fill gaps in the care plan. We lay out all the patient needs and we assign a person to fill the need. Now, I can just picture 95% of the people out there do this and their names next to every task. And therein lies the problem. So the goal is, I'm going to reiterate it again, we got to avoid putting your name on everything, and we got to find resources to get those names put against certain tasks. And, you know, some of you may check out at this time because you just think that's not even realistic, but we've got to at least try. So for instance, some examples, I'd like to show the enrichment kind of examples here because not everything's medical, right? But, you know, maybe mom's been having her hair done every Thursday. We need to think, is there someone available that can help her? Maybe she's still able to drive right now and get there, but in a couple of years or a year, when we have to make that tough decision of taking the keys away, how are we going to fill that need? And maybe the hairdresser can come to our home. A lot of services are coming into our homes nowadays, including doctors, for instance. So maybe dad likes to play cards at the senior center on Tuesday. We need to ensure that we have a plan for him to get there because we want to embrace that and we want to protect that for as long as possible. So that daily care plan, remember what you think is less important maybe what brings them the most joy. And I already used my Oprah example, but that's a really good example in my mind of, you know, where if I was caring for my mom and she wanted to watch Wheel of Fortune, it may not be as important to me, but I got to remember that is where she gets joy. So on this daily care plan, we want to include things as meal times, chores, appointments, exercise, hygiene, engagement, fun. And during this whole time, we want to really be thinking about them, not us, them. What are their likes? What are their dislikes? And we want to try to keep that in mind. Understanding that all this changes weekly, monthly, if not on a daily basis during some stages of the disease. So you just really have to try to remember to stay creative and flexible. The worst plan, now I'm talking about a lot of planning here, but the worst plans aren't flexible. They're too rigid. And this is not a time to have a rigid plan. Everything you plan is going to change. So you have to remember to stay flexible, specifically to help you keep your own sanity. And remember that one thing that worked today may not work tomorrow. So you want to try new things. You want to always, and then come back if something used to work, come back to it. And also stay creative in thinking about where to get resources. Who can help? Maybe you can reach out to the church, or you can look for other volunteer organizations. Talk to other caregivers. You want to just have that communication open and stay creative and always stay flexible. Yeah, Marshall's got a good point. Even dentists come to our homes now. And I think we're going to keep seeing more and more of this. So that can be a great service. I just at a function last week that Marshall was part of where the doctors were talking about how they come to and they bring care into the home, and they actually get to spend more time with your loved one because they're not on a quota. And because of that, they also, and the cost of it is very much in line with going into the actual brick and mortar establishment. So those things can really help out. And now you don't have to go through all that, the driving and all the anxiety that may come along with it. So there are definitely ways to help support our older population now. So let's just look at a quick and easy example of a daily care plan. This is a very basic, but this may be where you start. Grab a notebook. You don't have to use these forms. And in this instance, I'm just showing that, dad wants to groom at 8 a.m. And remember, if they always showered and groomed in the morning, you don't want to start making them shower and groom at night. You want to keep processes and stability in their schedule. If they've always read the newspaper in the morning, you want to adhere to that. So in this instance, I've just got 2 people caring for Pops, but this is where it starts. In a much more complicated example, and if you're a spreadsheet guy like me, you may just migrate right to this. But in this example, I'm showing how maybe it's getting a little tougher. So if you look up here in the top left corner, you'll see we have hand washing and dressing. And we do that 4 days of the week. We do that Tuesday, Thursday, Saturday, and Sunday. But the other days, we have company A hired. And because we can't shower mom, we can't handle that extra physical piece. And showering is not necessarily needed every day, but company A comes in on Monday, Wednesday, and Friday, and they do that task for us. Maybe if you go down the line a little bit, you'll see exercise. Keeping exercise going is really good, and if you can, bringing in an occupational therapist or a physical therapist or somebody like that can help your loved one through a daily or every other day routine or something can really have a benefit. So in this example, I'm just showing you how the plan can evolve and become a little more complex. Of course, you could tailor this spreadsheet however you want and go from there. All righty, well, I'm going to take a little pause right now and let it catch up a little bit and see if we've got any questions I haven't addressed yet. But I hope this is making sense to everybody. It is a lot of work, but with the right forms and doing just a little bit every day, you can conquer this, you can take back control, and you can enhance and protect the quality of life and care for your loved one. Now, I'm here for you. So if it becomes a little monotonous or mundane or you have questions about these worksheets, just reach out to me and let me know. I have Excel versions of them too that on the website, they're all PDF. So if you want the Excel version of it, I can send that to you. Just email me through. Most of you have my email address or hit the contact form on Together in this. Just reach out and let me know how I can help. Okay, I'm going to go back to screen share now and we'll wrap up. Okay, so the next steps you can take, all this information again is on Together in this. I based this whole presentation off of a 7-article series that I wrote. And so on Together in this, at the top toolbar there under Patient Care, when you click that drop down, you'll see the Patient Care Plan. Click that and it's going to open up a new page for you that's just displayed there on the right, where you'll see all the articles and you can go straight to something. So say tomorrow doing a patient medical action plan is your #1 buzz. You can just jump right to that article, read it, and go to the resources that are there listed there for you. You can definitely bounce around. You should do these things in parallel. And do a little each day again. So again, if that's overwhelming, just grab a notebook and a pencil. I mean, the old school is sometimes the best. So not only can you jot down notes, keep it by your lazy boy, start thinking about things. You can also start logging. This is a little diversion, but start logging any behavioral or issues your loved one may be having, because the sooner you can identify trends, the sooner you can come up with creative ways to maybe address those behavioral issues and reflect all that into that care plan. Also, print out the forms. Put them by your lazy boy. Take notes. Do something though, and stay ahead of it if you can. Otherwise, it's going to be a big burden to you when an actual crisis does happen. So, just in closing, I mean, again, I'm not saying any of this is easy, and I'm not saying it's going to work for everybody. It's going to take time. Caregiving is a huge requirement of your time, but if you make an investment in time here, that perseverance is going to pay huge dividends, because it's going to help you create a thought-out plan that's going to help you maximize the quality of life for your loved one. And that's going to have huge benefits for you, the caregiver. It's going to give you more me time. And sometimes that me time is just being able to sit down with them with peace of mind and engaging with them and enjoying that time together. It's really about getting out of the chaos of caregiving, taking back control, and being proactive. So that's my last chart. And I need to flip back over here to my ugly mug. And I hope a lot of that makes sense to everybody. Yeah, and I agree, Marshall. It is easier than not doing it, because you've been through it with your parents, and Susan, and a lot of you have been through this, and we just need to somehow influence the people going through it now and help them through it. And I did a lot of research in finding some of these forms and documents, and they're not easy to find, and they're not necessarily tailored for people with dementia, and but so hopefully this helps guide people and plan. And there are other great resources out there to use, so the worst thing you can do is to do nothing. And thanks, Susan. I got the whole lighting system going on to help me look better. So and all right, well, appreciate everybody for joining us today on the Togetherness Empowerment Workshop series. I've got another exciting workshop scheduled for next week, so look for that email. And I'm going to pop up that link to the, I should have done it already, but in a second you're going to see the pop-up to where you can go to Togetherness and get those resources. And again, they're all in one easy location for you. And just click that Learn More yellow sticky button there, and that'll take you there. Susan, I haven't actually thought to put them into a package yet, but that makes a lot of sense. I think I'll take that as a note and look at doing that. I did offer some of them as a freebie, kind of like my introductory guide, and I never really promoted it, but maybe I should rethink that and get that out there for people. That'd be a great way to do it. But for now, we can just start by going to that website location there. And again, I'll thank everybody, and I guess I'm going to sign off and go spend some quality time with the missus. So thanks again, and hope to see you next week, and look forward to it. Bye-bye.